Good day and welcome to JXE 141 Sports Injuries. My name is Ernest. I am a sports scientist focusing on the analysis of human movement. I also work in biomechanics at SEMLI, and I will be going through theme 2, which is movement screening and the prevention of sports injuries. So with this video introduction, I'm just going to touch on a couple of the headings. Namely, what is movement screening, why do we screen, and how do we assess human movement, how do we score, and what do we do with the information once we are done with the assessment itself. It is important to note that human movement screening does not prevent injury completely. When there is movement, there's an inherent risk of sustaining an injury. But what we aim to achieve is to identify risk factors which may lead to injury. If there is compromised movement or a restriction of some sort of movement, we can identify that early, address it early, and hopefully reduce the risk of injury in future, whether it be on the field or in the gym. It is also important to note that movement screening does not predict injury and it does not diagnose injury. We simply highlight risk factors through a series of movements and aim to intervene before they become problematic. So what do we do when we screen movement? We identify musculoskeletal risk factors which may lead to potential injuries, and we facilitate program design as well. I often use examples in my slides. You will see my race car analogies quite a few times. But essentially, we want to determine what a person is capable of doing. If they are not capable of doing a specific sort of movement, we need to facilitate progression of exercise to allow them to do that sort of movement. For example, if someone struggles to do a bodyweight squat, we can't expect them to do weighted squats within a gym. Rather, we should regress it to the point where we can achieve a perfect bodyweight squat, from where we can start loading them appropriately. It is also a good way of developing an athlete. So we can basically assess the way an athlete progresses through movement quality, whether they go from doing plain bodyweight squats all the way through to doing ballistic plyometric exercise. It gives you certain check marks as well throughout those sort of movements. And it allows athletes to challenge themselves as well. So if they do want to do a specific sort of movement, they realize that they should be able to do the precursors to that. You cannot do heavy squats until you can do a bodyweight squat. You cannot do plyometrics until you can do a heavy loaded squat, for example. The scoring system is quite simple. It goes from 1 through to 5, 3 being the core. Anything less than 3 shows that there's significant difficulty with doing a specific movement. 3 means that you can do a perfect bodyweight movement at a slow velocity. Anything above that means that you actually do that movement fairly well with increased load. But it is vital that you actually read through the slides that I have provided. They will explain everything fairly succinctly. That same scoring system is also used in the application, dictating what sort of exercises someone is capable of. So if they only score a 3 on a movement, there's no point in giving them exercises rated a 4 or a 5. Rather, give them exercises rated as a 3, building up to doing something that is a 4 if they can achieve doing that 4. I have included a couple of articles for you to read as well. Not too many. They are mostly focused on the movement competency screen, which is one of the screening tools that we use specifically. As with any human movement, attention to detail is vital. So please make sure that you understand the scoring system, the practical use of the scores, as well as the cueing and the quality of movement. There are slides looking specifically at the squat, the push, and the bend and the pull movements. So just make sure you understand how that movement is scored. All of these movements are scored from head through to toe. So if you're looking at something like the squat, we're not just looking at what happens at the hips, the knees, and the ankles. We're also looking at what happens in the shoulders and what happens in the head. I make use of a lot of analogies throughout this, as I have said, specifically my race car analogies. If those are analogies that you don't understand, I will be available between 11:30 and 12:30 on the 20th of May during your discussion board. Please feel free to ask me questions. Please feel free to ask me to explain something slightly differently if you do struggle as well. I think that is it. I hope you enjoy the content. I hope you learned something. And as I said, if you need anything, just let me know on the 20th of May between 11:30 and 12:30. Happy studying.